So our next question is, it says, "Hi, Dr. V. I'm 50 years old and missing my lower right molars. I'm considering getting implants to replace them, but I'm concerned about what might happen if I lose all my teeth in the next 10 years and need dentures. Would the implants have to be removed in that case? Could you please help me understand the implications?"
You don't have to worry about like your age. Absolutely not at all. And then you can, the great thing about the implants is, anytime you lose a tooth and you are going to get an implant. It used to be, oh, if you have missing teeth, oh, come see us and we can do implant. But now the culture has changed. Anytime you are going to miss a tooth, we can give you implants. So what that means is, you can have two teeth that you are going to miss now. You can get implants, and if you need a couple more, then you can do them later. Or if you are going to have two implants here, and then you are going to end up losing all your teeth on the other side, then you can always add more implants. So adding implants in increments, it's absolutely not a problem. Again, anytime you are going to miss a tooth, always think of an implant and talk to your dentist and your specialist, and they should be able to help you, just like we do in our office.
Yep,
right?
yep.
When they have a need to have a tooth removed, we remove the tooth, place the implant, do the bone graft, and give them the tooth on the same day. All happens on the same day.
Yep. One-stop shop.
Bingo. Right. No, one-stop shop is us, but one and done.
One and done. Yeah,
One and
one
done.
and done.
One and done. Yeah. Right.
All right.